Hi, I'm Dr. Randall Thomas. I practice here at Orthopedic Foot and Ankle Center, Columbus, Ohio. We're a high-volume multi-specialty practice that deals with all pathologies of foot and ankle, conservative and surgical treatment. I've been in practice for over a decade here, and we're a high-volume surgical practice that's well established, and we've trained people in fellowships that have gone on to practice throughout the United States and even internationally. Yes, so I'm using them as part of my double gloving system. So I'm using this new Thera and then using a classic over top of that. It functions very well. Feels like the same structure as a general orthopedic glove. I don't feel like I'm wearing too many gloves. It's got normal tactility and dexterity and maneuverability in the glove, but it's providing me a lot of moisture support and also safe for my patients, safe for myself. I mean, it's common, especially when we're training learners in surgery to get needle sticks or drills go through it, pins, at least in the orthopedic and podiatry space, that's very common. And I haven't had any needle sticks or problems in that regard. Certainly you'll hit the over glove and that gives you time to react, and then you can change out the instrumentation, keep the sterility, make it safer for everyone. But having that as my base glove, really helpful, and did not take down tactility, dexterity, and certainly helped with the dry skin issues. The tactile and dexterity part is really good. In the past, we would sometimes have to go to a single glove just because of the structure of the glove and not having as good a tactile sense. We know that double gloving is by far safe for the patient, for the surgeon, for the staff, and so my preference is to double glove. I haven't lost any of the tactility with that as far as instrumentation, hardware, implants, touching and feeling bone, soft tissue, skin, needle handling. It's all very good with the new Protexis system. Surgical gloves, regardless of the classic, the ortho, the new Thera, they have good strength. You have time. You're not going to just go through it and not realize it. So they react well. And it's interesting because you have a certain amount of strength without losing the tactile ability, which is good. They have systems where you can have a blue glove underneath, a white glove on top. That does help sometimes if you weren't to feel that you're going through the upper glove. You could see that there's exposure of the color. In my hands, I haven't had to have that. I'm able to use the white colored gloves, and I'm doing fine without having exposure or going through the gloves. Certainly, I've broken the over gloves. Everyone has. But since I went to the system, I have not had needle sticks or exposed skin, which is great. Saves me the trip to the emergency department for the blood draws, save the patient the blood draw and the costs associated with that if we were to have a needle stick, and we haven't. So it's been very beneficial. Yeah, so for my surgery days, my team knows that I'm a stickler for this now, that I use the Protexis PI Nuthera with the regular white orthopedic type glove as my base, and then I use a Protexis classic type of glove over top, and that's consistent every time. I get the moisture protection underneath. I still have the tactile sense. I don't feel like I'm wearing a lot of structure or bulk of gloves, and the sizing is consistent and has really saved me surgery time. Anything that can save us a minute, 30 seconds adds up over time for these patients that are under anesthesia to keep us efficient and get us out on time. So with the Protexis system, there's the Protexis PI Blue with Nuthera. Helps with the moisture. It can be an under glove or your first base glove. They are a different color. They're blue, which I think is beneficial. If you're using a lighter or not a structural glove on the top, and you have a break in that top glove, and you don't recognize it because you're in the middle of focusing on dealing with soft tissue, bone, hardware, trying to help these patients, the staff may see it. A circulating nurse off to the side may see, oh, there's bright blue, or a scrub tech, or your assistants or your trainees may see that, and then they can stop you and say, hey, you broke your over glove, and that gives you time to step back, put the new glove on over top, and decreases the risk. Once you've exposed the under glove or the first glove, there's more risk of it breaking and then exposing skin. So when we have these under gloves on, be them white or blue, there is some benefit to having them color, coordinated in the blue because it stands out, and the patient and the staff can see, hey, the patient may be at risk. The first glove's broken. Let's get this changed. And so there's some benefit to that. Or the surgeon themselves will look down and see it, and they can confirm it. Years ago, if we had a pin go through the first glove, there was really no way to tell if it went through the second. We'd have to pull on the glove, see if air came into the finger. If it did, then you know it violated it and went through it. If it didn't show air, you just keep it on. Take the top one off, put a new one on. But now that we have the color system of blue, it's very beneficial for that regard. Zhang et al. In 2021 had a really good study, kind of a landmark recent study on double glove versus single glove. And a lot of us reference that nowadays. 10 years ago or more, it was very common to do just single glove. Surgeons felt it was better tactile ability, better dexterity, and really the wave has gone to double gloving. Not only is it safe for the patients, but for the surgeon and the staff. So I think we'll continue to see that. And we have not seen in that study any difference really in surgeon perceived tactile dexterity in manual work with double gloves versus single. So we can look at some of our meta-analysis and data and really make a claim, maybe anecdotally, at least in my practice, that there's no difference in double gloving versus single gloving as far as outcomes, so we better be safer for patients and for staff and surgeons. Nader Henry et al. In 2020 in the Journal of Nursing did publish a paper on looking at latex, natural rubber latex versus no latex with gloves, and found that there was no difference to the surgeon in dexterity and handling or the physician. It worked very well. That study was also supported by Cardinal Health, and I think shows that this Protexis PI system is working well from a doctor or surgeon standpoint. Throughout the United States and healthcare systems, there's been a push to go to synthetic gloves and more synthetic type materials. We don't want to have latex in the environment because the latex allergies for patients can be pretty devastating. Not only that, but if latex is used, then there's a decontamination procedure for operating rooms, for healthcare facilities. It's very costly, time consuming, takes a lot of manpower, really slows down efficiency, particularly in the operating room setting, and not favored by hospital systems. Plus, we don't want to have any risk of a patient having some cross-contamination if that's not completely decontaminated. So using these synthetic gloves has been very beneficial. If we make an overall change to that, we don't have to worry about the cost of decontamination, the risk of a patient with a latex allergy, and we're getting the same benefit out of them, not noticing any changes with dexterity, tactile function, doesn't change the surgeon in the operating room, and people are doing very well. The Protexis gloves really benefited me because in a double gloving system, particularly with the new Thera style, I can have better moisture balance on the base glove, the first glove. The outer gloves still provide protection, but from a structural standpoint, it handles like a single glove, at least in my hands. So it's been very beneficial without a drop-off in tactile dexterity, work with the patient, from a skin, soft tissue, bone, hardware standpoint. That has not changed. All I've done is made it safer for myself and for my patients, along with the staff.